to Health Insurance Sherpa, where we guide your health insurance journey. As part of that journey, I wanted to include Medicare. Today's guest isn't just a Medicare advisor. He's also someone that I've known for 20 years, from starting out working for our fathers, serving on a local association board, and still meeting twice a month in a study group. I've seen firsthand the dedication that Mike brings to helping people make important healthcare decisions about Medicare. So welcome, Mike.
Thank you, Lisa. I'm excited to be here. Thank you for having me.
So I'm looking forward to learning more about Medicare. It's something that I find very confusing in the conversations that we've had over the years. And
it is very complex. There's a lot of moving pieces and a lot of different things to try to put together. So it's an important topic to discuss. So I appreciate you having me here.
Yeah, awesome. So today we're going to go through 3 sections. We're going to start with some common questions and details about Medicare. Section 2, comparing Medicare Advantage with supplemental plans. And then also Medicare myths, what's true and what is not true. So let's start with, what do you think people need to know right away about Medicare?
So something people need to know right away, I would say, is that it's a decision everybody has to make at some point. If they get to Medicare age, if they turn 65, this is a decision and a conversation that they have to have. So that Medicare train is coming, and you have to be ready for it when you get to that point. You can't just bury your head in the sand and pretend like it's not going to happen. It's a conversation everybody has to have.
Or maybe you're helping your parents or something.
Exactly, and that's a huge point, Lisa, is I'm currently going through that with my mom, and oftentimes that sandwich generation, they are the ones that end up filing claims and working with the insurance carrier or with Medicare to try to get things resolved for their parents that are maybe not able to do that depending on their condition or their age. So it's important not only for the individual on Medicare, but also for adult children or family or friends to be aware of their coverage structure, and because oftentimes they are the ones that are assisting with that process.
Right. So what about the different parts of Medicare? Maybe we should start with kind of the basics.
Sure.
4 parts of Medicare?
Yeah, so just to keep it simple and not difficult at all, right? There's 4 different pieces of Medicare. There's original Medicare, that's the original government version of Medicare. So
everybody gets that as long as they paid into it.
Correct. So there's 2 pieces to that. So original Medicare is Part A and Part B. Part A is the hospital portion of original Medicare. Part B is the medical portion of Medicare. Part A, the best way to understand that is it's inpatient hospital services. So if you are an inpatient in a hospital, that's Part A. It also covers things such as hospice, or if somebody is in a short-term acute care or skilled care environment, Part A will cover those services as well.
So those are the big claims.
They are.
Stuff.
Correct. And Part B is the outpatient side. So if you have a doctor, or if you have lab work, or the majority of Medicare claims on a non-emergency basis are Part B medical claims. Okay. That way, there is no premium for Part A. Typically, as long as you or a spouse have paid in 40 quarters or 10 years into Social Security, there is no premium for Part A. So Part A is covered. Part B does have a standard premium for this year of $202.90. So we'll round up $203 a month for Part B. And that can be adjusted based off of income, and I think we'll talk about that in a future segment for the increased cost of Part B depending on income. But just important things to be aware of when you get to that point. Basically, everybody that goes on to Medicare, original Medicare has to be a part of that piece. So whether it's Advantage or supplemental or prescription drug, everybody essentially needs original Medicare Part A and Part B.
Do you get it right when you turn 65, or how does the enrollment work?
In most cases, yes. So the easiest time for an individual to enroll in Medicare is called your initial enrollment period. It starts 3 months prior to your 65th birth month. It includes the month you turn 65 and continues for 3 months after your 65th birth month. So that's your 7-month window to sign up for Medicare. The earliest that your benefits would start would be the first day of the month that you turn 65.
Okay.
So, but you have a 7-month window. That's your initial enrollment period to sign up for Medicare, original Medicare Part A and Part B, and it's not the only time. You also have special enrollment periods if somebody is going to stay on a group plan that qualifies as creditable coverage post age 65, if they're going to continue to work or their spouse is going to continue to work, and it makes sense for them to stay on a group plan.
Right, the company is paying their premium.
Correct, yeah. Or if they have, most commonly, if they have a spouse that is not Medicare age yet and they need to stay on a group plan until their spouse ages into Medicare, oftentimes in those scenarios it makes sense for the older individual to stay on the group plan and defer their Medicare enrollment. So it's not a one-size-fits-all decision. Every case is different, and that's why it's important to kind of have that conversation so that we find the best path forward, whether that's Medicare or the group insurance plan or any combination of the two that way.
Right. How old is everybody? Are you going to keep working
on
the decisions?
Right.
Now, what if, let's say my birthday is today, and but my enrollment period I should have enrolled maybe at the 1st of June. If I don't start the process till now, does it backdate, or is it a future effective date?
Good question. So if you're in your initial enrollment period, it's for the month after. So if you enroll in
first
June,
of the next month.
Correct. So if you enroll in June, it would be effective July 1st. If you enroll in July, it would be effective August 1st. So as whenever you're in your initial enrollment period, if you enroll any time in that 3-month window before your 65th birth month, it automatically will start the day that you turn the first day of the month that you turn 65.
Oh, okay.
But after that period, it would be the month after.
Okay.
If somebody were to be coming off of Medicare after age 65 and enrolling in Medicare for the first time under a special enrollment period, you have a little more flexibility that way of selecting when you want your Part B coverage to start.
So maybe coordinating it with the end of your group coverage or
Correct.
something.
Correct. Yeah. Yeah.
Okay.
So
it's already getting a little complicated.
I wish there was a one-size-fits-all solution to all Medicare problems, but every direction has a different answer, and so that's why we have to be very selective with kind of what the best approach is that way.
And that's why you really need somebody to help walk you through this.
Sure.
I wouldn't want to try to learn that all on my own.
Right, and that's the tricky part. When somebody is in that initial enrollment period, they don't have somebody to talk to. About 6 months before they turn 65, the floodgates open, and they're bombarded with mailers and flyers and phone calls and solicitations of this plan or that plan. And the two biggest things I can suggest is what you just said is, one, find somebody to talk to, find a professional that you can rely on and can offer some educational advice to you. And then the second would be kind of all of the marketing materials, set that aside. There's one piece of material that is sent out directly by Medicare. It's called the Medicare and You book that is issued every year, and it has a lot of great information, easy to understand information.
Okay. Oh, that's nice.
It's not plan specific. It's not, pushing one plan versus another. It just kind of lays all the options on the table and provides a lot of information. So find somebody you can talk to. Yep. Use your Medicare and You book as a reference or a guide, and that's probably the two best places to start.
Okay. So that's plan A and B. And
correct.
There we have C.
So Part C is when we're putting everything in a box. There's Part A and B, that's original Medicare. Then there's Part C, which that is a Medicare Advantage plan. So
A private company would sell that?
It would, yeah. So the best way to understand a Medicare Advantage plan is it essentially replaces original Medicare. So while you still have to have Part A and Part B, Medicare is no longer providing any coverage for you going forward. The Medicare Advantage plan takes over as primary, and whatever insurance company that is with is the one that is providing your coverage for you going forward, not Medicare.
Okay.
So those plans oftentimes are called MAPD plans. They're kind of all-in-one plans.
What does that stand for?
So MAPD is Medicare Advantage Prescription Drug Plan. So
all inclusive.
right. So it'll include the health insurance side and the prescription drug side together, instead of having them be separate like other plans offer that way.
You have to shop separately for
Correct.
Part D.
Like a standalone prescription drug plan, correct. So
what about prescriptions? Would a Plan C typically cover your prescriptions well, or is it better to shop those with a separate Plan D?
So if you have a Medicare Advantage plan, you kind of have to have it together. You can't really shop for a separate prescription drug plan. Everything would be with under one umbrella, one roof that way.
Similar to what a group plan would be now.
Correct.
An ACA plan where it's all under one policy.
Looking at a Medicare Advantage plan, the best way to look at it would be like an ACA plan or a group health insurance plan. They're offered through a private insurance company. Okay. They have co-pays, they have co-insurances. They
function similarly.
Very similar, okay. Very similar. An Advantage plan is very comparable to what somebody would have with a group plan or an ACA plan. They're network based, so they're either an HMO or a PPO. That's one important distinction.
I thought they were all HMOs.
Most of them are today.
Okay.
So last year, that's one big shift we saw from last year to this year, is that most of the Medicare Advantage plan carriers moved away from the PPOs and moved more to an HMO network-based plan offering for this year. We'll see where that goes in the future, but that is a big shift that people that were accustomed to having a PPO offering are now moved into an HMO type plan, and whether they like that or not.
So they were automatically moved.
So the way that process would work is they're disenrolled from their previous plan. If that plan goes away, right? If that plan goes away, then they are dropped from the Medicare Advantage plan and would have to get a new Medicare Advantage plan, either with the same carrier or with a different carrier. The time frame to do that is every year during the Medicare annual enrollment period from October 15th through December 7th. That's kind of the critical time for individuals that are enrolled in a Medicare Advantage plan to make changes to their plan or to try to make any adjustments that way. So it's the one thing to consider with a Medicare Advantage plan is that there can be a lot more volatility with it. Like we said, from the PPO to the HMO, if you can't qualify medically to move out of one of those plans, if you're in a Medicare Advantage plan and if you wanted to switch to, which we'll talk about in a little bit, a Medicare Supplement plan, after your initial enrollment window when you turn 65, if you wanted to move out of a Medicare Advantage plan and into a supplement, you would have to qualify medically in order to make that change. You would be medically underwritten. So
it can be hard to do after age 65.
It can, and all it takes is one medical incident or diagnosis, and then if that takes a supplement off the table, then you're kind of locked into the Medicare Advantage model forever. So
sounds like that might be one of the things to consider when you're young, when you're healthy and just first turning 65.
Sure.
That things can change.
Right. Yeah, it's not only planning for today, but looking down the road as far as, where my health, it might be great at age 65, but at age 70, 75, 80, how do I want to have my coverage structured in the event something were to happen later on down the road?
And in both of our situations, we have a parent in assisted living.
Yep.
Due to health conditions.
So things do change.
Things can change.
Absolutely, and they can change in a hurry. So.
Yeah, for my dad, there was nothing until he was maybe 78.
Right. Yeah.
So. And now it's quite different.
Right. Yeah.
He needs extra support.
Right.
Okay. Well, so A, B, C, D, but then we also have standardized plans with the same letters, really, right? We have Plan A Medicare, but then the supplemental plans are lettered also?
Yeah, so supplement, just because Medicare likes to make things confusing, right? So we have...
It's a government plan.
Yeah, right. We have original Medicare A and B, and then we'll kind of skip the Medicare Advantage because, like we said, that's a replacement type plan that replaces Medicare. If somebody were to have a Medicare supplement, oftentimes that's called a Medigap plan. They're commonly referred to as either a Medicare supplement or a Medigap plan. If you were to have a Medicare supplement as your secondary coverage, in that case, and like you said, there's 10 standardized plans. So we don't need to go through all of them. The two most popular plans today are a Plan G or a Plan N Medicare supplement. Those are the top two most popular choices today.
Are they the richest, or why are they popular?
Mostly for that reason. So the Plan G covers the most. The Plan N is next in line. So they're very comparable as far as what they cover. Plan N has a slightly less premium because they don't cover as much as a Plan G. So it's kind of where somebody's comfort level is that way for a cost of a plan.
Okay.
One important distinction I should have made on an Advantage plan is the reason why a lot of people go in that direction is that there is typically a $0 additional premium.
Wow.
So while there are restrictions, while there's volatility and there's maybe some uncertainty because the insurance company is the one that is providing your coverage going forward, the zero premium is an enticing factor there that way.
A lot of people look at that first, right?
They do. Sure.
Today things keep going up. So.
Right. And that's
where
where
a factor for sure.
If a Plan G or a Plan N Medicare supplement has $150 to a $200 a month premium, if that is not in somebody's financial budget, then a Medicare Advantage plan is the right decision to make because there's no reason to put somebody in a plan that is unaffordable and causes financial hardship when there's a viable alternative that can lower their premium that way.
Yeah.
I tend to lean towards a Medicare supplement. I advise clients either direction, whatever is in their best interest.
Yeah. I know because you present all the options, right? And you
correct.
Them pros and cons, and then
But I've seen how both work, and for myself or for family, if a premium is affordable for a Medicare supplement, I think that's a much better way to structure your Medicare coverage.
Right.
One of the reasons for that is that Medicare is primary and the supplement is secondary. So in that environment, you follow the rules of Medicare. The two most important pieces, in my opinion, of original Medicare is that there's no networks. So you can see any provider nationwide as long as they accept original Medicare. And two is the insurance company no longer has authority or control over your health care coverage going forward. So if you have a Medicare supplement, which is with a private insurance company, they follow Medicare's ruling. So Medicare is the decision maker. If Medicare approves a claim, the secondary plan, the Medicare supplement, has to follow whatever Medicare says. So they can't deny a claim that Medicare has approved. So that's one of the reasons why I prefer that structure of coverage is it takes that prior authorization issue and a lot of the concerns that people have with the insurance companies off the table.
So let's talk about health savings accounts. That's something that is becoming more and more popular on the ACA. Now, if you just have any bronze plan, you can contribute to an HSA even if you have copays. So I think more and more people might be funding them, and then what happens when they go on Medicare? Do things change?
That's a great question. So an HSA, very valuable tool for covering qualified medical expenses. It allows people that if they have a Medicare Advantage plan and may have some higher claims or copays, that you can use the HSA to pay for those qualified medical expenses. You can also use your HSA and Medicare to reimburse for your Part B premium. So you can't use it for if you have a Medicare supplement plan, a Plan G, a Plan N, or whatever plan it is. You cannot use an HSA to pay those premiums, but you can reimburse for that Part B premium, which is that $203 a month premium for Part B of Medicare. So
nice.
It is.
What about the drug plan?
So for the drug plan, you can use it to pay for prescriptions if you have a copay, depending on if it's an expensive medication or whatever the case may be. You can use your HSA to pay for those qualified medical expenses. The main consideration with Medicare and an HSA is you cannot be actively making contributions to an HSA if you have any part of Medicare active. And that's where
anything.
anything. And that's where sometimes we'll see an issue. If somebody is going to stay on a group plan and defer their Medicare decision to a later date, if they enroll in Part A of Medicare and keep their group plan, because there's no premium for Part A. You can enroll in Part A, defer Part B, and stay on your group plan in certain situations. And if they have Part A active and then the group plan has an HSA that they're able to contribute to, oftentimes they don't know, and it's not their place to know, right, that you can't,
don't know what you don't know.
you can't contribute to the HSA. So that is an important distinction. If you are planning to move to Medicare, or that decision is coming up, and you do have an HSA that you're contributing to, you would want to stop making your contributions to your HSA a month prior to when you enroll. And just to make it even more confusing, if you defer after age 65, you want to shut off your HSA contributions 6 months before you move to Medicare.
6 months.
Because they will backdate your Part A coverage by 6 months or to your 65th birth month, with whichever comes first. So
that's a big back.
It is. It is. So, and that's one that catches a lot of people off guard, is that if you wait if you defer your Medicare enrollment and start that process 3 months prior, which is usually plenty of time, but if there's an HSA complication, that delays the process even further. So it's HSA is a wonderful tool, and it's a great thing to have when you're on Medicare, but it can cause some sticky enrollment issues.
You don't want to get into sticky situations with the IRS.
Yep, absolutely not. Yep. Yeah, so HSAs are great. You just have to be mindful on Medicare.
Right. Okay, perfect. Well, let's get into segment 2, where we're going to talk about Medicare Advantage versus original Medicare and the supplements.
Sure. Yeah, so we can kind of talk about 2 different kind of real life situations that just by happenstance
experience, that somebody's had.
So kind of have a situation that has happened here recently, that my mom about a week ago fell and was at the aquarium with my niece and slipped and fell, broke her hip. Was transported by ambulance to the hospital, had surgery, and then was discharged from the hospital to an acute care rehab hospital or facility she'll be there for about 2 weeks, and then she'll be discharged to her assisted living community with some additional resources like home care. So
how's she doing?
She's doing very well. So the surgery was successful. She's doing 3 hours of physical therapy a day, which she may not be overly happy. She may not be overly happy about, but it is. It is. They're doing a great job, and she's doing a really good job with doing what she's supposed to do. So hopefully she makes.
It's all about being a good patient. Let me
absolutely.
tell you.
Yeah. So hopefully she makes a full recovery from that and gets back to normal. But how that picture looked with her coverage. So my mom has original Medicare A and B, and then she has a Plan F Medicare supplement. I don't want to make things confusing, because Plan F is no longer available. They discontinue
but she has
that
it somehow.
She does. So in January of 2020, they stopped issuing new Plan F Medicare supplements. So that's why today a Plan G or a Plan N is kind of the next in line.
Gotcha.
The distinction with a Plan F is that it covers everything that Medicare does not cover.
Everything.
So it fills all the gaps. So like for instance, Part B of Medicare has a $283 deductible. Plan G does not cover that. That's the only out-of-pocket expense somebody should have if they have a Plan G Medicare supplement. Plan F covers that. So
that's a really low out-of-pocket.
Right.
Especially somebody having a surgery.
So 100%, 80% is paid by Medicare Part B, 20% is paid by her Plan F Medicare supplement, and she pays nothing for medical services at that point. If she were to have a Plan G, she would pay the first $283 out of pocket in the form of the Part B deductible. After that, Medicare pays 80%. The Plan G would pay 20%, and she would pay nothing, or anybody would pay nothing out of pocket for anything that's approved by Medicare after that point. So looking at her example of this real world Medicare claim. She was transported from the aquarium to the hospital via ambulance. that will be covered. Medical transportation covered under
That can
Part
be
B.
$1,000 right
It can
there.
be. And then the hospital, because original Medicare is primary, it's not as big of a concern. If it was an HMO plan, as we know, that some hospitals are in network, some are not. So where you're taken is a big piece of that decision. But because Medicare is primary, as long as the hospital or the doctor group or whoever it is, as long as they accept Medicare, you can go wherever you want to go. So there was no out-of-pocket costs with her surgery, with her hospital stay. Wow. She was in the hospital for just over 3 days. And all of that was covered at 100%. When she moved to the skilled rehab, the acute rehab facility, that was coordinated by Medicare, so Medicare is approving and covering that expense for a short period of time. They cover Medicare covers the first 19 days of acute care, skilled care, and then her supplement will cover up to the next 100 days of care that way.
Per situation or per year?
Per situation.
Okay.
Yeah. So they define that per benefit period. With Medicare, a benefit period is a 60-day window of time. So every benefit period that way. But
well, how nice to just not have to worry about her claims, really, right?
Right.
And just worry about recovering.
Exactly. So, and that's the big is that when you have a Medicare supplement, when you buy a Medicare supplement, because there's an additional premium, you're buying peace of mind. You're buying knowing that.
I use that all the time.
Right. Yeah. That you're knowing that God forbid something major happens, or even something minor.
An accident.
Right.
Yeah.
Something as simple as going to the aquarium with your granddaughter and having a fall that completely changes the picture for the next month or two, right? And if you didn't have the right coverage in place, could also be a very costly and expensive situation as well. So, and that's what I'm experiencing with the other side. And not to say that this is how every Medicare Advantage plan works, because it's on a case-by-case basis. But given my mom's situation where everything is covered, we don't have to worry about any surprise denials or anything of that nature.
Or appealing a claim, which
Correct.
happens,
Recently, just coincidentally around the same time, I got an email from a group insurance agency that I kind of consult with on the Medicare side. And the email was in reference to one of their clients on the group plan. Their mother had a Medicare Advantage plan. And similar situation, slipped, fell, broke her leg or her hip. And because Medicare is not making any of those decisions, the Medicare Advantage plan company is the driver, was having a really difficult time with claims being paid. So they were saying that certain tests that were provided in the hospital were not necessary. So those claims were getting denied. The insurance carrier was saying that she could have received care at a different facility. So they were fighting on that front as well. And we're having to appeal all of these denied claims, and it's
it is a hassle, and it can take weeks or months.
It can, and there's no guarantee that the appeal is going to be successful.
And that's terrible.
And so, although the Advantage plans may have a low premium cost, when something like this happens, not all the time, but occasionally it can cause some financial hardship, because there can be denied claims, there can be situations that can be very expensive from an out-of-pocket standpoint that I think people need to be aware of. Again, not to say that this happens in every situation when somebody has a Medicare Advantage plan, but it is a real life concern, right? Sure. That it can happen, because the insurance company is the one that is primary. They're in control.
The care
exactly. Versus Medicare being the one that is approving. And Medicare is a lot more, I don't want to say lenient, but they have looser guidelines on far as what is medically necessary. If it's medically necessary and a doctor is recommending it,
that's enough.
Chances are it's always going to be approved, right? Yeah. So the insurance company is not the one that is dictating to the doctor what's approved and what's not approved.
So it's a kind of a restrictive HMO in I guess in our under 65 terms.
Correct. Yeah.
Okay.
Yeah. So, and we'll see what the future holds for the Medicare Advantage market if they open back up to PPO options. I mean, it's just right now there's a lot of volatility, a lot of uncertainty with that market as things are kind of unfolding that way. So,
what do you think's going to happen? You've been doing this long enough.
We're in a situation where, and this has been brewing for years, but with the Medicare Advantage plan, the reason why they have a zero premium or a very low premium is because Medicare is subsidizing the insurance companies. Okay. So Medicare is no longer harboring the insurable risk, right? So they pass that over to the insurance company because they're taking it off of Medicare's books. Okay. Medicare subsidizes the insurance companies for taking on that insurable risk. Gotcha. So there's been a power struggle over the last several years where the insurance companies are saying we need more money, Medicare's saying no, and so the insurance companies are having, without increasing premiums, are having to get creative with some of the extra benefits that they offer. Like if they offered a vision and dental benefit, if it used to be a $2,000 or $3,000 dental benefit, now it may just be for preventative services. Or so they're instead of raising premiums, they're stripping some benefits, and we'll see what the future holds for that. If that's something that gets worse as time goes on, or how the subsidies are kind of affecting the Medicare Advantage market. But it's a gap that's been widening over the last several years, and I don't know if there's going to be a reasonable solution to that issue. So we'll kind of see what the future holds.
Right.
Yeah.
And we'll have to keep people posted on
Absolutely.
that, right? Because things change.
It does. Yeah. Things change every year. Yeah.
Every few months even. Sometimes.
Yeah, every year things change, and that's it's important to stay on the type of plan you have, and if there's any changes that are available, or how your coverage will be affected from one year to the next.
Right, or just knowing what your plan is and what parameters you need to stay within. Right. And be prepared in case something does happen. Right. Okay, if I need to go to the hospital, I need to go to this one, not that one.
Right. Exactly. Exactly. Okay.
So what are some gaps in coverage that people might have? Dental, vision, hearing. What parts of Medicare might cover it, or do you need supplemental plans?
Yeah, so that's a great question. So like we just touched on the basics of a Medicare Advantage plan, they do offer some extra services that Medicare does not cover themselves. So basic vision, basic dental, that are extra benefits that are included on some, not all Medicare Advantage plans. But in original Medicare A and B, they do not cover. It's rare that they would cover anything for dental. Vision is a little more of a gray area where they will cover things that are medically necessary, like a cataract procedure, or if somebody has
similar to under 65.
Correct. Yeah. If somebody has an eye disorder like macular degeneration, they will cover the medical necessities of eye care, but they don't cover routine. So they don't cover a routine eye exam or glasses or credits for lenses or frames or contacts or those type of things. So if somebody needed those services and had original Medicare and a supplemental plan secondary, they would need a separate vision and dental plan to kind of fill in those gaps.
Okay, gotcha. And then, so let's get into our last segment.
Yes.
Let's get into some Medicare myths.
Okay.
What's true, what's not true. So these are not my opinions, these are just myths, common known myths.
Very good.
When we've kind of covered this, but Medicare covers everything.
Yeah, Medicare covers a lot, but they don't cover everything. So it's important to know, and it's also important to be kind of your own advocate when you're talking to your doctor and just saying, hey, this is how my Medicare is structured, whether it's an Advantage plan or original Medicare paired with a supplemental plan. And just be vigilant and say, hey, this is what I have. Before we do anything, I want to make sure that this is going to be covered by my plan, whether it's original Medicare or a Medicare Advantage plan. So you just...
How do you use your plan?
Yeah. So it's important. You don't have to ask that question all the time. Most things on original Medicare would be covered without having to have an issue, but it is important to kind of be your own advocate that way.
Yeah, definitely. Another myth. Medicare is free.
Medicare's not free. I wish it was. Yeah. Yeah, right. So Part A is typically free for most people, but Part B does have a premium. If somebody were to have a Medicare supplement, that's an additional premium. Mm-hmm. The prescription drug plans vary across the board. They can be a zero premium or they could be $100 a month, depending on somebody's needs.
Swing.
So,
wow.
You have to be mindful of what that budget is, especially if it's for a husband and wife, if there's a spouse and you both have your individual coverage, being aware of what those premiums are. So it's an important piece of the puzzle.
Can you shop your plan, your drug plan each year?
You can.
Without underwriting or any issues?
So the drug plan is we review that every year during that annual enrollment period from October 15th through December 7th is the window to review drug plans. If somebody during that year has had a change to their prescription needs, or if the plan itself, if the prescription drug plan changes from one year to the next, which they do very frequently. They can change their premium, they can change their pharmacy network, they could change their formulary list. So one year they may cover a drug, the next year they may not. So
you really need to look at it.
You do.
Year.
Yeah. The supplemental plans are kind of on autopilot. So the supplemental plans, if they're annual renewable and they're non-cancelable, so as long as you continue to pay your premiums, you're never going to be dropped from that type of plan. So those are a little more fluid from one year to the next. But it's still important to review if one company is more expensive than another on the plan on the supplemental side, and somebody is healthy and able to switch carriers, it's worth at least looking at your Medicare coverage on an annual basis. And the best time to do that is during that annual enrollment period from October to December.
I start working with my clients sometimes ahead of time, like looking up their doctors. Can you do that with Medicare?
Somewhat.
As far as drug research or anything?
So there's guidelines as far as when we can reach out. There's compliance guidelines for when we can start that process.
Yeah.
So
when can you start?
So October 15th is the start of the annual enrollment period. October 1st is kind of when we can start that conversation to kind of start gathering some information that way before the plans.
Every day counts.
So we that's a limited window that we have to try to jam everything into. It's a very hectic and chaotic time, as you know.
I can relate.
As you know, with the ACA plans.
I only get 6 weeks, Mike.
Sometimes I wish it was longer, but then I don't, right? Because it's such a chaotic time. But it's an important time to at least, at a minimum, review your coverage. If no changes need to be made, then we just leave it alone and everything is fine. But if we miss that window and there's something that we need to capitalize on or make an adjustment, it's a critical time to do a review. So I would suggest or recommend to everybody during that annual enrollment period, if you have an advisor, if you have somebody you're working with, or even on your own, would be to review all forms of coverage that you have and see if any changes need to be addressed.
Yeah. Well, we should probably talk on that real quick. If you don't have an advisor, try to find one, right?
Sure.
Ask friends, other people your age, or even maybe a financial advisor, a CPA, your PNC or other.
Absolutely. I think
everybody should have a network. We do that.
I think it's critical to have somebody to advise. Even if you didn't talk to somebody in your initial enrollment period, it's not like you missed the boat. You can go find somebody that can help you either confirm the decisions you made or help you make changes if you need to make adjustments. But when you're turning 65 and you're getting flooded with all of this information, it's such a, from clients that I've worked with, you can see the stress lifted from their shoulders once we have a conversation. And it's like, okay, now we have a path forward. Now we have a direction. Now we know what we're going to do. And it eliminates all the rest of the noise. So all the other papers.
I like the way you said that.
Right. Everything else we can kind of just set aside, and we know exactly what we're going to do. But unless if you don't have somebody to talk to, you don't know what path is the right direction to go. And so I think it's critically important to find somebody. If you have a neighbor or a friend or anybody that can refer you to a Medicare advisor, I think it's critical to have somebody to talk to.
Yeah, absolutely. Okay, how about if I have Medicare prescriptions are included?
So they are not. That's an important distinction. If you have original Medicare A and B, that's hospital and medical, you would need a standalone Part D drug plan to cover anything for prescription drug expenses. And that's also true if you have a supplemental plan. So if you have original Medicare A and B, that would be one box. You would have your Medicare supplement plan would be your second box. That's the health insurance piece. Mm-hmm. And then you would have a standalone prescription drug plan. With a Medicare Advantage plan, oftentimes the prescription drug coverage is included with that. So you would not need a secondary standalone prescription drug plan.
Yeah.
So
so complex.
Right.
So complex.
So I wish there was a yes or no Medicare question, but there is none. So yeah, everything is it depends. Right. It depends on your coverage.
Okay. Okay. Another myth. Once I choose a plan, I am stuck forever.
So it depends.
Yeah.
Yeah, right? So depending on how coverage is structured. So if you, like we talked about earlier, if you have a Medicare Advantage plan and you would want to switch to a Medicare Supplement plan, you do have to go through medical underwriting in order to do that after age 65. So if there's a health consideration, if you have a Medicare Advantage plan, you may not be able to switch to a supplemental plan now or ever because there's a medical concern. That doesn't mean you can't switch between different Medicare Advantage plans. You can go from one plan to another. Correct. Okay. But you're stuck in that structure. If you have a Medicare Advantage and you can't medically qualify for a supplemental plan, that's what you have, and we just have to find the best plan that's going to work in that structure of coverage.
Yeah. One thing that I've heard is that once your first decision is the most important.
Is
it because of this choosing an Advantage? Maybe because, hey, I'm healthy, I don't want to pay $200 a month, or
yeah, and that's a good point you made, Lisa, that I don't think I mentioned before, is when somebody is in their initial enrollment period, when you're turning 65 and you have that 7-month window to sign up for Medicare, you cannot be turned down for any reason. There is no medical underwriting. So you could have every medical consideration in the world, and you would still be able to qualify for a Medicare supplement plan. You have a 6-month window to where you can select any Medicare plan for the supplemental side. After that's closed, then medical underwriting comes into play. So that initial age 65, or whether it's 65 or you're coming in under a special enrollment period, it's a critical time to make the most informed, decision that you can, because there are no restrictions as far as what plan you can choose.
What might be another special event? Like on the ACA, it could be marriage, divorce, have a baby. What kind of we call them SEPs, special enrollment?
Yeah. So the special enrollment periods typically are when somebody is coming off of a group plan. Okay. So you have your initial enrollment window at age 65, and then the special enrollment period, if you voluntarily or involuntarily lose coverage from your employer, you have an 8-month special enrollment period to sign up for Medicare.
That's a long enrollment period.
It is. Wow. It is. So they give you some time if you lose group coverage. An important distinction there, and this is an area that you kind of focus in, is COBRA coverage is not considered creditable coverage with Medicare. So oftentimes a mistake that we can see is somebody's on a group plan after age 65, they come off of that, they go on COBRA instead of enrolling in Medicare for a period of time. And if it's longer than that 8-month window, Medicare does not deem that as creditable coverage, and they've missed that 8-month special enrollment period.
I'm surprised they don't. It's covering all the essential benefits.
I know. Yeah, but Medicare does not deem COBRA as creditable, so it's a viable option before age 65, but after age 65, you have to be very careful with COBRA. Yeah. So, and if somebody were to miss one of those enrollment periods, if you miss your special enrollment period or you miss your initial enrollment period, you can't just sign up for Medicare whenever you want. You have to follow those enrollment periods, or you enroll during the general enrollment period, which is every year from January to March, is Medicare's.
Another enrollment period?
It is. So if you missed all of your enrollment periods and you need to sign up for Medicare, every year you can enroll from January to March. Okay. But if there's a delay in your coverage from when you should have signed up to when you did sign up, there can be late enrollment penalties that stay with you forever. So it's critical that you're mindful of those enrollment periods when you're first turning 65.
Yeah.
And I think it's very important when you turn 65, whether you go on Medicare or you don't, you need to have a conversation about that, because you don't want to miss an opportunity to enroll that can have dramatic impacts on your coverage going forward with late enrollment
Or your
penalties.
costs too, right?
Exactly.
You
Yeah.
pay a higher premium.
Yeah. And those late
I think
enrollment
that's another
penalties.
segment we might need to do.
We can definitely, there again, we could talk for 4 hours on the differences, the nuances of Medicare, which
Yeah.
I think we'll do in a separate segment.
Okay, perfect. So I think that's a great place to stop for today. Today we covered the basics, the major decision points, and a few myths that may have caused confusion. So thank you for listening. Thank you, Mike, for being here today.
Absolutely.
And definitely like to have you come back.
Would love to.
I think next time maybe we will talk about the transition coming off of an employer plan and looking at Medicare. And even though it is so complex and confusing, if you have someone like yourself helping you, you don't necessarily need to understand all the pieces, but somebody to at least guide you through
Right.
that confusion.
Right. And I think it's also important, like somebody in your space, Lisa, that handles the individual or the group side, to be a part of that process as well, to know what those rules are and what the guidelines are. So I think it's very important to have we can certainly have a separate conversation on that.
Perfect.
Yeah.
Perfect. Well, thank you for spending time with us today. I hope this made Medicare a lot more clear for you. Subscribe for more useful health insurance advice. I'm on YouTube, Apple, Spotify, and more platforms. If you know somebody that would benefit from today's podcast on Medicare, please share it. It will help them, and it also helps grow this new podcast to reach more listeners. If you have a question or suggestion for another podcast, I would really love to hear it. Comment below, or you can email me at lisa@ecafinancial.com.
Thank you, Lisa.
Thank you.